Hello friends, welcome to Medicine Hub 101. Today I will be talking about one of the very important topic from the aspect of the pathology, and this is the very initiative topic. There is the cell injury. So let's start the topic today. Cell injury. Now we can see what cell injury means. There should be the injury within the cells. Now the injury can be happen. There we can see also the injury within the cells by the different ways. So you can say there is some physiological factors, there are some chemical factors, there is like some immunological factors, okay, like these things. So you can say the injury of the cells that may be for what, the physiological factors, physiological factors that may be for the chemical factors, that may be for the immunological factor, immunological factors. But the most common cause of the cell injury, I'm repeating again, the most common cause of cell injury, that is the hypoxia. Okay, so just it's the oath statement, you have to remember it. The most common cause of cell injury is the hypoxia. Okay, and today we're going to focus regarding hypoxia. So basically, what is hypoxia? We all know it that hypoxia is nothing but the deficiency of oxygen at the tissue level. We can say others, and sometimes we can also at that as per the cellular levels. So hypoxia is what? Hypoxia means, I said it. Let me write it here. That the deficiency of oxygen, deficiency of oxygen at tissue level. Now, to have the very good concept regarding hypoxia, we need to clarify all the points and the deep concept from the hypoxia. Now basically we can divide the hypoxia basically in four types. Before that, let me write it here. First of all, okay, drawing is not that much good, but assume. First suppose, see it not looking like lungs, but take it as lungs anyway. Whatever it is, and we will know, we all know it what, that first the atmospheric O2 that will come out here, we don't know it. Atmospheric O2 that will come within the lungs through the bronchial system, it will go to the alveoli, and from the alveoli it will come out by the process of diffusion, it will come within the circulation. And from the circulation, what we can see, from the circulation it will go within the cells, in the individual cells, to be utilized in the cells. So what is the thing here? The O2 that is coming out within the lungs, okay, at the time when the partial pressure of the oxygen will be greater within the alveolar, then by the process of diffusions, we can say what, simple diffusion, the O2 will come out here, and the O2 will get combined with the hemoglobin of the RBC, and it will form what, oxyhemoglobin. And after that there will be the flow of the what, flow of blood, you can say blood flow simply. And after that the oxygen, with combining with hemoglobin will come within the cells, and it will utilize for the, that's the oxidative phosphorylation, the further steps in the tissue cycles and the electron transport system, of course. That's another thing. Now basically we have to know what the hypoxia, basically four types. Okay, hypoxia basically four types. So types of hypoxia, I'm writing it here. Types of hypoxias. So first of all, the hypoxic hypoxia. hypoxic hypoxia. Hypoxic hypoxia, that means what? Whenever there is like the deficiency at the level of oxygen, okay? For suppose if there is like what? The okay, if there is like the amount of the oxygen is lesser, then the partial pressure of the oxygen will be less within the lungs. So if the partial pressure within the lungs is less, then it cannot diffuse easily. So it cannot go to the cells. Ultimately, what, there will be no utilizations of the oxygen within the cell. There will be no TCA cycle. So we cannot have that much energy or ATP, whatever you can say, that is required for the cell for its functions. Okay. Now I'll go through the hypoxic hypoxia. So what are the causes for happening the hypoxic hypoxia? First, suppose if we go to the high altitude, if we go to the high altitude, okay, at the time what? At the time there is in the atmosphere, there is the amount of the oxygen that is less. So ultimately what, the less amount of oxygen will go within the lungs. So you can also have the what, hypoxic hypoxia. That's the in case of high altitude. Then we are having what, another type of the disease that's very very important topic or disease we can say, that is chronic obstruction pulmonary disease. Chronic obstruction pulmonary disease. Okay, at the time what, for suppose if there is an embolus, just consider it. For suppose if there is embolus or obstruction, if there is an obstruction within the lungs, then what will happen? The carbon dioxide that will not go to the, that will not leak from here to outside. Okay, so what will happen? The amount of the carbon dioxide that will get increased, because there is like what, there, if there is like obstruction within the bronchial systems, then what, ultimately the carbon dioxide will not be able to go out of the lungs. And we all know it what, that our lungs is having a such capacity, okay, to contain minimum amount of the carbon dioxide as well as oxygens. So most of the places of the lungs that will be taken by whom, the carbon dioxide. So as a result the oxygen will not be able to come here because there is obstructions. So we can say in case of the chronic obstruction pulmonary disease, that is what, retention of carbon dioxide, retention of carbon dioxide in these cases, guys. Then what can you say? There is one more thing, that is interstitial lung disease. For suppose if there is like the membrane, if the membrane or the there is too much thick, if there is too much thick, then it's not also possible for the oxygen to come directly, easily you can say from here to here, if there is like any thick membrane. So there will be what, interstitial lung disease, interstitial lung disease for thickened membrane, right, for thickened membrane. Okay, guys, for thickened membrane. Then we are having also one type of the thing, there is RL shift, RL shunt you can say, that is for RL, right to left, there is the right to left shunt. That means whenever there is like in the ratio of the ventilation and perfusion that is mismatched, at the time you can have this type of things. You all know it. Where ventilation and perfusion mismatch, guys. At the time we can have this type of the hypoxia. So what did I just say? That the types of hypoxia, first I just discussed about the hypoxic hypoxia, that means the deficiency of oxygen only, okay, deficiency of the partial level of the oxygen here. So it may be at the high altitude. When you will go to the high altitude, at the time the atmospheric oxygen is less, so you can have the less amount of oxygen to utilize. Then we are having the chronic obstructive pulmonary disease, where the retention of the carbon dioxide, okay, retention of the carbon dioxide, why there is obstruction within the bronchus, first suppose, then there will be the increase of the carbon dioxide will be more there, and there will be no amount of oxygen, because the oxygen will not come out here. So as a result the amount of the carbon dioxide will get increased. Then we are having what, the interstitial the lung disease. In this case that there is the thickened membrane, so there may be the diffusion may not occur there so easily. And at last I said the word, the right to left shunt. So there is the ventricular in the ventilations, and the perfusion ratio is not matched. At that time you can have this type of those things. Now we will go through the another topic, that is the anemic hypoxia. You know it. That's the first type I said, that is hypoxic hypoxia. Now I will tell about The anemic hypoxia. Okay, guys. Now, anemic, we all know it. The anemia means what? There is the less amount of the blood. If there is less amount of the blood, we all know it that that's the anemic hypoxia. But in the true sense or in the scientific sense, we can say what? In terms of medical terms, that anemic hypoxia, that means whenever there is like the less decrease functional availability of hemoglobin, that will ultimately lead to what? Less functional RBC or red mass, less functional red mass. So ultimately, what can you say? If there is the decreased functional availability of the hemoglobin, that is like, so there will be less hemoglobin. If there is less hemoglobin, of course, there will be less amount of the oxygens to get combined with the hemoglobin. That is not sufficient for our body, for our cells. Okay. Then we are having on. Okay, so you can see the less concentration of hemoglobin first. Less concentration of hemoglobin. It can happen. For suppose in a person's body, if there is like the amount of the angel, we know how much, 12 to 15, gram per deciliter. We know it out of 100 grams. 100 gram out of 100 ml, we are having 12 to 15 grams. So it's normal. But in some persons, it can have that they can have the less amount of the normal, less amount for the normal with respect to the normal range. They cannot have the normal range. They can have the less amount than the normal range. So there is like less concentration of the hemoglobin. That's what the functional from the point of the view of the functional things here. Okay. Then we are having the what, the altered hemoglobin. They are very important, guys. Altered hemoglobin. Now we have to understand what is altered hemoglobin. Okay. Not enough oxyhemoglobin. Okay, not enough oxyhemoglobin. First, suppose altered hemoglobin, to understand these terms, you have to understand a very good concept. Just let me give an example for you. That first, suppose in our body there is 15 gram hemoglobin. Okay, hemoglobin, and by any means, of course, for suppose if there is like a room heater. In a room there is the room heater with less ventilation, if there is a room heater in less ventilation, then what will happen? The temperature will get increased. And first suppose another, just take another example, that is, okay, first suppose in a vehicle or in a car, okay, if the temperature, that heat comes continuously for any technical issues, and whenever the doors and the windows, all the things will be closed at the time, the temperature will also get increased. So ultimately we can say what, there is like the amount of the carbon monoxide that will get increased, and whenever we will take the carbon monoxide within our body, at the time what will happen? CO poisoning. Why it's altered? Let me tell you now. First, suppose in our body there is 15 gram of hemoglobin, and we all know it, the carbon monoxide is having much more affinity than oxygen to get combined with the hemoglobin. It's near about 200 times. Near about 200 times more. Attractive. To get combined with hemoglobin than oxygen. Okay, guys. Now what will happen if the amount of the carbon monoxide get increased in our body? Then what? First of all, in our body there is, let me just tell the example in the another page. Just be with me to clear your concept, guys. Okay, hope you are seeing it. Now in our body, first of all, 100 gram hemoglobin. 100 gram hemoglobin out of 15 gram hemoglobin. And whenever the amount of the carbon monoxide is get increased by any means of cause, but I just said that it may be for the room heater, there is less ventilation, and in the vehicle it may be there also. So for then if the amount of the carbon monoxide that is increased, then what it will 10 gram of the hemoglobin will get with hemoglobin. Why? Because they are having more affinity. They are having more affinity. CO, that is CO, CO. So the 10 gram of the hemoglobin is get combined with the carbon monoxide. But the rest 5 gram hemoglobin will get combined with oxygen. But in our body it was needed to get combined with the 15 gram hemoglobin with what? Oxygen only. So instead of that, what we are getting only functional, how much? 5 gram hemoglobin to get combined with oxygen. So of course there will be less functional hemoglobin, right or not? So we can say this is the in case of the carbon monoxide poisoning, we can have this type of the things. Okay. So what are the things like the symptoms we can say, or by which we can understand the carbon monoxide poisoning? Now carbon monoxide poisoning, that may be what? For the headache. Okay. And we can also have this, the most important thing here, that is like the change in color, of skin and blood. ভিডিওটা বন্ধ করো নাটক। There is change in color of skin and blood, that is called the cherry red color. Cherry red color. You can have the question from here many times. We can have the question. So in case of the carbon monoxide poisoning, we can have, whenever the carbon monoxide will get combined with the hemoglobin, as we know that the carbon monoxide is having much more affinity than the oxygen to get combined with the hemoglobin here, guys. Okay. So as a result, what can you see? The change in color of the skin and the blood. So it's called the cherry red color. And you can also give in the highlight things. If you are having, if you do have it, then you can. If you don't have, then try to buy and then mark it like this. So this is the very important point. You can have the question from it. So this is the carbon monoxide poisoning. Now, as we will know it, that we all know that we don't have that such drugs by which we can just get the recovery immediately, right? Like this. Okay. So as we don't have the, you can say what? As we don't have drugs to manage this condition. So what can we do? We need to give them, the patients those are having the amount of the carbon monoxide in their blood, give them higher concentration of oxygen, by which the oxygen may be able, the O2 may be able to displace what? To displace carbon monoxide from hemoglobin. To displace carbon monoxide from hemoglobin here, guys. Okay. So as a result, the amount of the partial pressure of the oxygen will get increased, and it can displace the hemoglobin there. You understood? I think you understood. Okay, this is all about what? It was all about our anemic hypoxia. So anemic hypoxia may be for two reasons. If there is like the less concentration of the hemoglobin, that's another thing. But if there is altered hemoglobin, now the altered hemoglobin may be by any cause of the pathological things. It may be for the, I just said an example, that the carbon monoxide poisoning. Okay, you can take it also as example here, guys. Now we'll talk about the myth hemoglobin here. Yeah, it's also very, very important. There's the myth hemoglobin. what is it? Before understanding these things, we all need to know one more important things from the basic of these things. We all know that in our body there is F2 plus that can get combined. There is a ferrous, and this can get combined with this would like to get combined with oxygen, and will ultimately form what the with form of hemoglobin in terms of hemoglobin. Yeah, of course it is within the hemoglobin the ferric. Okay, and there is a process by the oxidation process. It can get converted into Fe3 plus. With what the oxygen will not get combined. Just understand it. The Fe2 plus that is normally present in our body, that is the suitable form to carry oxygen. Why? Because this too is suitable for oxygen, because within the hemoglobin there is such alternation or formation of the protoporphyrin rings, that is protoporphyrin rings, so that makes it so stable to get combined with oxygen. But whenever we are having the Fe3 plus, what we can say the ferric, at that time what will happen? This ferric is not having this capacity to get combined with oxygen to carry the oxygen through the blood. Okay. Now, by chance, if it gets converted anyhow by the process of oxidation, if the Fe2 plus get converted into Fe3 plus, then there is an enzyme in our body. There is an enzyme. By the action of that particular enzyme, the Fe3 plus can get converted into Fe2 plus. And name of the enzyme is cytochrome V5 reductase. Cytochrome V5, or you can write V5 reductase, by which we can see the Fe3 plus will get again converted again into the first form, that is Fe2 plus, that is the suitable form what the oxygen carrying form. Okay guys, you can also mark it here. Okay, now this now what is the clinical aspects we have to know in case of especially the newborns. In case of newborn babies around 3 to 4 months, there should be around 3 to 4 months at the time, they are having the higher risk, higher chance to cause the condition of Fe3 plus. Why? We can write the newborn, in case of the newborn having high chance to cause the oxidation of Fe2 plus. That means what? The Fe2 plus will get converted into Fe3 plus. Okay, when we will see these conditions, having the higher chance to what? To cause the oxidation of Fe2 plus in case of the newborn. But when will we see these things? We have to know it also. When there is exposure of some drugs. That means if you just give some drugs to the newborns, especially what, the sulfonamide, the name of the drugs you are supposed to know. Also try to remember the name of the drugs: sulfonamide, and also you can also give the nitrates. And if we give this type of the drugs to the newborn, also we can use the local anesthetics. And if we give this type of the drugs to the newborns, then they can have also the chance to have the oxidative form of Fe2 plus. Okay, now the Fe3 plus, why it's dangerous? The methemoglobin, why? The Fe3 plus, this can form what? Meth hemoglobin. This can form what? Meth hemoglobin. If it can form the meth hemoglobin, then what will happen? For which less oxygen will get bind with hemoglobin. Less amount of oxygen will get bind with hemoglobin. Why? If the because if the amount of the Ap3 plus get increased, then that means what, the amount of the Ap3 Ap2 plus that is not increased. So ultimately what will happen, because we all know it that the Ap2 plus is having only the capacity to get combined with the oxygen, but Ap3 plus is not having such capacity. Now if the amount of the Ap3 plus get increased, so of course there will be less oxygen that will get combined with the hemoglobin here. Okay guys. Okay. Now one more thing, for suppose if we just consider these things, for any individual, if the amount of the enzyme that is if there is deficiency in the enzyme, for any individual, if we just consider there is the deficiency of the enzyme, there is the cytochrome B5 reductase, at that time what will happen, that is also hypoxic anemia. Why? See it here. For suppose we can see what, if there is deficiency of cytochrome B5 reductase, if there is deficiency of this enzyme, then what will happen, that will cause ultimately hypoxic anemia. Why hypoxic anemia? Because whenever it will be there, so as a result of if there is not there, if it is like functionalist or deficiency of the enzyme is here, then what, the Ap3 plus cannot be converted into what, the Ap2 plus. So if there is less amount of the Ap2 plus, then what can we see, there will be not a sufficient amount of the oxygen in our body in the tissue, so it's also called on type of the hypoxia. That's why it's called the hypoxic anemia, because of the hemoglobin is less functional here, or because of the formation of Ap3 plus. Okay guys. Now to manage these things, what can we see? Now to manage these things, you were having the chance to